This is another exercise that's relatively simple, but we'll talk about some nuances of it. Side lying external rotation for the shoulder. I've got a weight in my hand is 2.5 pounds. So obviously the basics of the movement are pretty simple, but the nuances are a couple of things. One is you can see my elbow is, well, my arm is resting on top of a pillow, but my elbow is a little bit up in front of my trunk, meaning my shoulder's flexed 15 or 20 degrees, and that helps the infraspinatus muscle work. It optimizes the length-tension relationship with the infraspinatus. So the second part of this is going to be scapular positioning. So usually I cue my patients to include that little bit of a posterior tip. I train them, helping them understand the proper motions of the scapula, and then at that point I'll have them do a little bit of a posterior tip. You can see it's subtle with the arm hanging in front of me. And as I come up into external rotation, I may have them accentuate that motion a little bit, and then they slowly come down. So I'm having a posterior tip, then on top of that fixed base, they externally rotate. You can see I'm keeping my elbow at 90 degrees. A lot of patients want to kind of do something like this or like this, which is essentially cheating. Keep that elbow at 90, elbows dipped in front of the body, as I said before, and I've got a little bit of gentle scapular positioning throughout.